design is a key part of how a hospital runs. You can answer Melissa's question first about what the difference is between the former hospitals and now this in terms of the design of the rooms.
So the rooms that we have on St. Elizabeth's campus is the campus I'm most familiar with, but the rooms aren't really efficient for our patients and for the nurses who are delivering care to our patients. Just doesn't really allow us the space to give the care that we need to be giving. The design of this new room is really patient-oriented, giving the right amount of space around the bed, and just setting up the room in a way that's efficient for everybody. So it's really kind of helping us be more efficient at what we're doing for our patients.
Is there more space in these rooms?
These rooms are bigger than the rooms that we have on our floor, the floor I work on right now.
How much bigger would you say they are?
They're substantially bigger than the rooms on our units, and the all private rooms really helps give more space to specific patients as well.
So in terms of mapping out the spaces, do you guys, use it to mock, interact with the patient? Is that how you see the difference and find out if these rooms are actually okay to use, I guess?
Yeah, the great thing about these design processes is that it's not just nursing that's involved, it's PTOT, it's respiratory therapy, it's all the departments that have their hands in taking care of the patient. And what one department may not offer information for, another one does. And today, for an example, PTOT has a lot of perspective on what will work for the patient and moving the patient around the room. And really, this stage is where we can say this doesn't work, we don't think this is going to be great, and we can make changes to adjust to what we think is safe for the patient.
Were there any challenges coming up with the design of these rooms?
I think it's challenging sometimes for us to think outside of what the processes that we're already doing, because we've had to adjust our processes to the environment that we have to work in. So it's kind of hard to think in more of an innovative manner on the sky's kind of the limit in what we can do with this new facility. So it's been harder for some people to think kind of in a new way of doing things, but fortunately with visiting some of the other hospitals that are newly built on some of the trips we've gone on, it's really helped kind of think of what we can do and give us more ideas.
Has anything come up since creating mock rooms, either positive or negative, anything that you see where you say, I really like this new idea, or okay, this maybe isn't working, this is what we can do instead?
Oh yeah, even just now when we were in the rooms, there's some people like things this way, some people think it's not going to work. So that's the kind of great part about this process, is that we can move things around. Everything can be adjusted at this point in the phase of the design. So we can go through and say, well, we don't think that this chair will fit here, we think that this sharps container should be over here, and there's a lot of flexibility with what we can do in this part of the process.
Will there be any rooms that have 2 beds?
I believe there's one on each wing, has the capacity if for some reason that we had a surge that we could flex up if we had any kind of instance where we're seeing an influx of patients. But our primary goal is to keep the rooms private unless it was absolutely necessary.
And kind of a weird question, but because these are bigger rooms, does that, seems like that would mean you can't have as many rooms, but do you think the benefits outweigh that?
Absolutely. The patient experience is everything. If we can create a safe environment for our patients and an efficient environment for our nurses and our healthcare providers to provide care, the number of rooms doesn't always seem to trump what we can do inside the room.